With opioid addiction tearing apart families and communities, a new front to battle the growing epidemic, medical schools, training the next generation of doctors.
I think that it's just really important to equip our new doctors with this ability to be able to talk to patients, to be able to know what's the appropriate dose of opioid to prescribe a patient and what's inappropriate.
Schools are taking action after critics said they were failing to teach students about opioids, a class of drugs that includes powerful painkillers including morphine and illegal drugs like heroin. Recent studies have found many physicians prescribe opioid painkillers too often.
I've tried Advil and Tylenol, it's not really helping.
Using actors, the University of Massachusetts is teaching students how to identify if patients are suffering from addiction and when it's appropriate to prescribe opioid medication.
I had the oxy that you prescribed me from the surgery, and that seems to really help.
Other schools are increasingly using similar simulations.
There are these 3 other prescriptions. Who's Dr. Miller?
Yeah, I must have been the doctor I saw at the ER.
Opioid painkillers were blamed for almost 19,000 overdose deaths in 2014 in the U.S., a 400% increase from the year 2000. Hoping to set a precedent, medical schools in Massachusetts are rolling out a statewide curriculum on opioids, rethinking pain management.
It was a situational issue in which we were told we had to treat pain. We followed instructions and we eliminated pain, and then we created another problem.
Dozens of schools across the country have received federal grants aimed to better equip students to screen patients for drug abuse.
The thing that scares me the most is not being able to detect it.
But with the rising number of opioid deaths, these future doctors are learning to confront it head on. Krista Fourier, Associated Press.